Hello, everyone. Welcome back to another session of A Day with your fertility specialist. I'm your host, Joanna Damina. Thank you for joining us. Again, we would like to say thank you for your consistent engagement, your consistent likes, every click, every share, every comment. We really appreciate that. On that note, please make sure to share this with someone that you think will be interested in learning more about fertility. Today we have a very interesting topic. So make sure to bring as many people along as you can, okay? This month, September, is PCOS Awareness Month. If you don't know what PCOS means, it means polycystic ovary syndrome. So if you know someone that has been interested in this topic, if you yourself have been interested in it, if you've been diagnosed and you want to know more about it, want to burst some myths around the topic, then please stay with us until the end of this. We have a very special person with us today. We have Dr. Jane or Jenny. Welcome.
Thank you, Joanna, for having
So,
me.
I've been good. How have you been?
Very well, thank you.
It's good to have you.
Thank you very
Welcome
much.
as always. So, Dr. Jane is a consultant gynecologist. She's also a minimal access surgeon and a fertility specialist. So, she has a lot of insights to share with us about the topic. So, make sure you stick around to find out more. Okay, so Dr. Jane, like I said, I told them what the full meaning of PCOS is, but could you go into it a little bit more? What actually is PCOS? When someone says PCOS, what exactly should they be thinking about?
Well, polycystic ovary syndrome, or PCOS as shortened, is a common hormonal condition
Yeah.
seen in women of reproductive age. By that I mean women between the ages of 15 and 49.
Oh,
Yes, so it's causes some form of hormonal imbalance
mhm.
or and formation of abnormal eggs or what we call follicles. But commonly the hallmark is them having a lot of male hormones,
Okay.
what we call androgens, and
Okay.
you see that in some of the features they present with. So PCOS is very common. Well, it's so common that up to 13% of women in this age group
Oh
can have
wow. Yeah.
PCOS,
Mm-hmm.
and up to 70% remain undiagnosed. That's a lot of
That's
people have
true.
the condition, but they
Mm.
are not diagnosed. So it's that common. I think it's this celebration of this month as PCOS month is what is
Yes.
supposed to be.
And we're doing this as well to bring some awareness to the topic because, like she said, a lot of women that have this condition or that have PCOS, this syndrome, are not diagnosed. So, if you hear something that piques your interest, you can always come in for a consultation, by the way, and then have a full diagnosis on what exactly is going on in your reproductive system. So, like I said, to pique your interest a little bit, let's talk about things that you see in PCOS, some symptoms, should I say, or signs that someone can see and then think maybe they should come in to, get a consultation about that.
Okay, so some of the common signs or symptoms, well, I mentioned that we have excessive
Yeah,
male
male hormone.
hormones in patients or women with polycystic ovaries. And most of these features, they come as having excessive hair
Okay.
on their chests, on their faces, on their chin. I know all of this can cause some, make them uncomfortable when they are
Yeah.
with people.
Mm-hmm.
And they can also have acne that don't respond, like, or will I say what commonly called pimples, that don't respond to the regular form of treatment. Those are common things you see, but not just that. Sometimes you can also do some blood works and you see that the male hormones are very high. So it can be clinical features of maybe what we call hyperandrogenism, either
Okay.
you run tests
Mm-hmm.
or physical features. Then coming to the menstrual part, some of the common symptoms you see about 70% of women that have infertility from the ovaries,
Mm-hmm.
from polycystic ovary syndrome, and they have irregular menstruation, irregular poor air quality, so increased risk for infertility. Some of these women can also have some form of will I say psychological symptoms that they
Mm-hmm.
can come with depression, anxiety, infertility is a problem. They have excess hair, they have social phobia because they cannot relate to people. So
Mm-hmm.
they can also have some form of depression, some psychological challenges. So the symptoms are a whole lot.
There's a
And
wide
again,
range.
as we have all of these women are also at risk of some other what we call metabolic conditions. You know, when we say hormones, they
Mm-hmm.
are more like metabolic things. Metabolic things are just body's chemical activities. They are increased risk of having diabetes,
Okay.
they are increased risk of having hypertension. So most times you see some of these things, you know, different phases of life have different presentations. So at different times you could present with any of these and this condition can actually be diagnosed.
Hmm.
But by and large, you can also make diagnosis from some blood tests in
Okay.
the lab.
Yeah, interesting, of course. So, about those stages in life, like you said, it starts from the age of, you can have PCOS from the age of 15, right? So, what kind of things do we see at, like, are there differences in different stages of life? What are those
Yes.
symptoms like as they grow?
Well, you know, PCOS is with the individual,
Mm-hmm.
so it's almost like a continuous thing.
Okay.
But commonly in the adolescents, what you commonly see is irregular periods.
Mm-hmm.
Sometimes that could cause some panic for the parents and
True.
all of that. But most times the irregular period, you want to take it after first 2 years of commencement of menstruation because of immaturity of the brain in the first 2 years of menstruation. So that's something you see. Then you commonly see acne with them too. They have acne, then excess weight gain, obesity, and all.
Mm.
And a lot of times people tell them it's common with puberty and they remain undiagnosed.
Yeah.
Then when we now come to the real reproductive age or what we call the older adults, let's say 20 to 30s and all of that, commonly they present with infertility where they are trying to get pregnant and you know at some point they come to the hospital and when you do a scan that's when it peaks that they have polycystic ovaries and
Okay.
all of that.
Mm-hmm.
Then also continuous they also we have this continuous hair growth continues with them. Yes, I didn't mention that for the young adolescents they could also
Okay,
have
they have that
excessive
too.
hair growth
Hmm.
too. Then the adult is a continuum. Then when you now go to midlife, I mentioned as a metabolic condition, they now
Yeah.
have increased risk for hypertension. That's where you see the diabetes,
Hmm.
hypertension,
Mm-hmm.
problems with their thyroid glands, and all of that. Then for the older women, because of the 50s and above, or even the mid-cycle, midlife,
Midlife,
that's
yeah.
40 to 50 and also 50 and above. Remember, they don't have regular menstruation.
True. They
So
start to
the
use.
estrogen keeps building the lining of the womb. So there's also increased risk
Mm.
for cancers of the lining of the womb for them. It's what we call endometrial hyperplasia, endometrial cancer. So it just keeps going from one stage to the other and the symptoms persist as they grow.
Okay, so you spoke about how it may cause a bit of panic, especially in teenagers for their parents when their child doesn't have regular periods. I mean, usually that's associated with other kinds of gynecological cases. But how can you reassure? Like, how would you reassure parents? That if you're a parent out there and you feel like you have seen these symptoms in your young child, pay keen attention to what Dr. Jean has to say. Like I said, she's a specialist and she's also an expert in the field, so she can tell you what will allay your fears. So, Dr. Jean, what can you say to a parent out there that might have seen these symptoms in their child? Like you said, after the first 2 years, of course, but if they've seen these symptoms, what can you tell them to make them reassured, let's say?
Well, it's already is a genetic condition.
Okay.
It's not you want to assure them that it's something that has is manageable.
Hmm.
It's not a condition that has to do with is a finite thing that you cannot there's no solution.
Hmm.
You can actually manage different conditions or depending on the stage of life. So for these teenagers, commonly they have irregular periods. You can actually regularize their period with some
Okay.
medications and all
Okay.
of that. So that is what we can do for them. For those that hair suits that have excessive hair growth,
Mm-hmm.
you can actually also manage that.
Mm-hmm.
So basically for PCOS, you manage the symptoms that troubles the client at the
Hmm.
time. So for teenagers, what bothers the parents could be managed. So it's not an end of life or no solution kind of, though not curable, but manageable to satisfaction.
Okay, okay, that's good to know. So if you've paid keen interest, then I hope that you're, more reassured about the topic. But of course, stick with us. There's still a lot more to learn. So the people that have those symptoms like should I say, the physical symptoms. Let me talk about weight gain, facial hair or excessive facial hair. Does everybody that have those symptoms necessarily have PCOS, or are there other,
Okay, no, not everyone with those symptoms have PCOS, and that is why we don't just because a woman says I have irregular periods, then you have PCOS. There are a lot of causes of um,
those symptoms?
symptoms like stress, fibroids, thyroid hormone malfunction, and all of that. Those can cause irregular periods. Then there are other conditions that can, if I'd mentioned that in PCOS we have excess of the male hormones, what we call androgens. Someone can have a tumor that or a growth that secretes androgens, and it could present with similar symptoms such as excess hair growth, deepening of voice, and all of that.
Okay.
But for those kind of um, condition, the symptoms are usually rapid, and when you do your blood work, the male hormones are way higher than what you would see in the regular PCO women. Then sometimes people that have thyroid problems too, they can have irregular periods, they are slow, thinning out of their hair, and all of that. But in thyroid conditions, you also do your blood work, you see the thyroid hormones are way out. And commonly with them, what you see is just the metabolic challenge. So it depends on what you see. Then for the obesity, there's a condition called Cushing syndrome. These people they gain weight on their belly and on their faces.
Okay.
Where we call the egg on stick appearance. They are very big, the tummy and all of that. So, but when you do some blood work, what differentiates that is that cortisol in those women will be higher compared to what you have. So it depends. So there are a lot of things that could mimic PCO, and that is why you don't just sit and assume that is polycystic ovary. Rather, maybe when you seek help, probably the right and appropriate help will be offered.
So there are specific criteria that we look out for, like especially with the blood work when you go to see your doctor or you go to see your gynecologist. There are specific things that you look out for. It's not just that once you see those physical symptoms or the symptoms they present with, then you just, assume. So there's specific things
Yes,
that we look out for.
there are specific things you look out for. Actually, to make a diagnosis of polycystic ovary syndrome, there's what we call the Rotterdam criteria that is used,
Yeah.
and it has about 3 things listed underneath. So anybody that has at least 2 can comfortably classify as someone that has polycystic ovary syndrome. So for those, we have the features of hyperandrogenism
Yes,
or
like you
excess of
mentioned.
the male hormones, either physical or laboratory tested, like
Okay.
biochemical.
Okay.
You can also have people that have irregular periods or chronic anovulation, that's oligo reduced frequency of their periods, and also absence when they don't ovulate.
Yeah.
That is also one of the symptoms. Then finally, people that have polycystic ovaries on ultrasound. So when you pick any 2 of these conditions in a woman, you can comfortably say she has PCO, even though you might see all of those and still the patient might feel okay. But that is what we use to greet men.
I'm still smiling because but you have to thank Dr. Jade for being simplistic with us. We would have all been lost by now. So thank you for that. Um, I wanted to talk about there was something you just mentioned now. Um, the cysts. You're talking about ovarian cysts. Can someone have ovarian cysts without PCOS or PCOS without ovarian cysts, vice
Yes,
versa?
yes. If someone can have ovarian cyst without PCOS,
Mm.
ovarian cysts are almost like a part of a woman's menstrual cycle.
Okay.
So we have what we call, when we say physiologic cysts are just normal cysts that happen because of her cycle. Probably you have 1 or 2 follicles responding to the hormones leading to pregnancy and all of that. Then she ovulates, and the other one regresses at some point.
Yeah.
There are also some other forms of what we call abnormal cysts. When we say pathologic, when we say physiologic, it just means a normal thing that goes with life, while pathologic means like there is a problem.
Okay.
So there are other forms of cysts, not necessarily PCO. And what people call cysts in polycystic ovaries, they are not really cysts per se, because you grade cysts based on the size of the measure what you get.
Okay.
So if I measure a follicle, what I assume is a follicle, and I get above maybe let's say 3 centimeters, for instance, I'll begin to think that it's a cyst.
Okay.
But follicles are usually lower. You
Mm.
see them 1, 2, 2 point something and all of that. But anything above three, you start thinking. And the size again is not something you don't have to rush. I think I should come to this point where I mentioned that every cyst should not be treated. Some cysts, as we have established, are just part of your life process.
True.
But if you have a cyst that keeps growing, increasing in size, causing some other things like pain and some weight loss, then you might need to seek help with your gynecologist.
Okay. So some people can be wary about should I say, coming to you about reproductive conditions or anything that has to do with their reproductive system. How do you make your patient or your clients feel more comfortable talking about this, especially being truthful about it? Because, like you said, it affects some of them mentally. There might be some mental health defects and all that, that they think they have anxiety and then depression. How do you encourage them to see somebody about this and then to be more honest about it when they do see someone?
Well, sometimes, when people seek help, it comes from a place of insight.
Yeah.
You now understand your problem. You now know this is a problem. Well, someone you could just see a lady having irregular periods. She's not bothered. She's excited about it. I don't have to get sanitary towels every month. I don't have to have those pains and cramps like my
True.
colleagues and all of that. But when she now comes to you and you're able to establish that, okay, this is a challenge, this is a problem, and she understands that this is what she really gets to that point of understanding the problem. I think from that point, she'll be open to discussion, she'll be open to receiving help, she'll be open to any form of treatment that would improve her symptoms at the time. Remember, we said PCOS is treated based on the symptoms that is most troubling to the client at the time. If it's your hair growth, we treat hair. If it's cycle irregularity, you manage that. Infertility, so there are different things to manage what concerns the client more. So once they understand their problem, they're able to open up to you.
Okay.
Yeah.
That's valid. So I spoke about busting some myths earlier. That's in the beginning, and I hope you were there. But if you're not, if you're joining us again for the first time through this, we're talking about PCOS. We're trying to understand the basics of PCOS, and we'll have more through the rest of the month. So this is just the first part of this awareness, and then talking about PCOS. So I want us to talk about some myths around PCOS, right? I personally have heard some, right? That it's only, should I say, overweight people or overweight women that have PCOS, or it's only like people who have those facial hairs or excess hair growth that have PCOS, and then once you get it, you can't get pregnant, things like that. Can you tell us the truths around that?
Well, just like you heard, I've heard so too. Well, but for women with hair, I think a lot we have established that you can have a tumor that secretes the male hormones and you'll have excess hair.
True.
So not all women with hair would have PCO, and not all PCO women will have hair.
Okay.
So you can have that from different conditions, and it's also genetically inherited. If you are from a hairy part, your ethnicity rather, that's the word. If you're a hairy part, you have plenty of hair. So it doesn't have to be one for the other. Then for women that are overweight, yes, it's common with them because one of the commonest presentation or one of the common presentations of PCO is what we call insulin insensitivity. Why I mean insulin? Insulin is just a hormone that helps to break down the sugar we take in. So now their bodies don't respond. So they tend to gain so much weight. Their bodies don't respond to those, and that increases the risk of having diabetes. So, but we would see that PCO can actually, you can, women with average weight women and women that are very thin can also have PCO.
Okay.
About pregnancy, women with PCO can actually get pregnant on their own. They can also get pregnant through treatment and also lifestyle changes. So it's not a sentence that you cannot get pregnant. Then commonly we also hear that people with PCO have cysts. but that's not the case.
Yeah.
What they call cysts are not really cysts. They're just
Mhm.
tiny fluid-filled sacs that circle the ovaries, just like the rosary bead or pearl of strings
Okay.
appearance. So nothing
You make
much.
it sound nice. Rosary bead pearls. I mean, like who would want to have pearls? But also, like I said, I also heard about once you have PCOS or any other hormonal condition, you can't lose weight. As if you have that weight gain or rapid weight gain or excess weight gain, you can't lose weight. And there are other things that you can't do. Are there any other myths that you've heard of, or is this true? Like once you have PCOS, you can't lose weight and you can't
Well,
make
weight
any
loss in
changes.
them truly is very
Difficult.
difficult.
Mm-hmm.
Yes, it's very difficult, but it can be achieved through lifestyle, through consistency,
Mm-hmm.
and also surgically. You can have some surgeries to cut down your weight.
Okay, that's
Yeah.
true. That's true. And by the way, we've spoken about cosmetic surgeries on here. So if you weren't around for that, please do well to go back to our channel, our social media platforms, and look at that video, that live session. It's all still there waiting for you, so you can go and look at that. We've spoken about how cosmetic surgeries affect or do not affect reproduction. Now, about those lifestyle changes, Dr. Jane, like you said, it's one of the things that can help to allay some of the symptoms of PCOS. Is that like exercising and diet? Like what kind of lifestyle changes can a woman with PCOS implement to have relief of these symptoms?
Well, commonly exercise and diet.
Hmm.
As little as 5% weight loss in women with PCO can actually increase improve the frequency of their menstruation,
Okay.
improve their chances of ovulation, and
Mm-hmm.
also pregnancy
Okay.
occurring on
Wow.
its own. So it's basically is exercise, diet, and
Mm.
all.
Okay, so these are things that I mean almost every doctor would advise you to do. Manage your lifestyle, exercise more, have a better diet, and how about sleep? Does sleep affect these
Well,
syndrome?
not directly. But of
Mm-hmm.
course, stressors can also affect your period and ovulation, but
Yeah.
not necessarily improving your PCO per se.
Mm-hmm.
Yes.
So like you said before, it's is not it cannot be cured. Like, is that what you meant?
Yes, polycystic ovaries, you cannot cure PCO.
The whole syndrome, but
Yes,
you
but
it
you
can
can
be.
manage every
Mm.
symptom to satisfaction.
Okay, wow. That is very specific. You manage every symptom to satisfaction in such a way that the person will feel comfortable even when they have PCOS. And
Yes.
then I'm going to just touch a little bit about these treatment and how it affects fertility. But please don't go into too much. We want them to stick around for other sessions where we talk about PCOS treatment. So, are there any specific treatments for these symptoms that may show?
Okay, polycystic ovaries syndrome.
Yes, yes.
Well, there are specific treatments. Like
Mm-hmm.
I said, for people with irregular periods, you can regularize their periods
Mm-hmm.
using some of those pills,
Okay.
contraceptive pills.
Okay.
For you can also either using medications. Then those that are having challenges with fertility, you can induce ovulation
Mm-hmm.
either using drugs, using injections, or even minimal surgeries like drilling holes in the ovaries. You can
Mm.
do all of
So,
those to help them ovulate.
mm-hmm.
And ovulation is just releasing eggs, potential eggs to be fertilized by a sperm coming. Then basically, those are the things you can do. Then for those that have excess hair growth, you can actually, there are a lot of things
Mm-hmm.
that you can use to manage hirsutism, even up to lasers, shaving,
Wow.
creams,
Mm-hmm.
and also hormones can help reduce the conversion. Some drugs can actually reduce the conversion of some of those chemicals in the body to the male
Mm-hmm.
hormones and reduce the excess hair growth. For acne, you can also treat using the specific things we use for managing acne.
Okay.
Sometimes the dermatologist come in to manage your
Okay.
acne. So for every condition,
There is a
there's
treatment.
There's a solution, but not cure.
Okay, well, thank you for going into that. Like I said earlier, Dr. Jane is a minimal access surgeon as
And
well.
sorry,
So,
just to
okay,
add,
go
for
ahead.
fertility, I think we also have assisted reproduction too
True.
for people with
I mean,
PCO.
yeah,
Yeah.
of course. So, yes, she had to bring that up. And I hope that piqued your interest because, like I said, we'll be going more in depth into this topic as we go further until the end of the month. So, Dr. Jane, thank you so much for being here with us today. Thank you for your professional insights and the humor as well. It was really lovely having you.
Thank you so much for having me. I also enjoyed myself discussing polycystic ovary syndrome. Thank you.
Yes, thank you. Is there anything that you think you would want to still talk about, or just an advice out there to anyone that might be dealing with these symptoms and this condition?
Well, nothing more. Just to recap
Mm-hmm.
or wrap up what we have discussed. Polycystic ovary syndrome is a common metabolic or hormonal condition, causes hormonal imbalance. Commonly, you have infertility, present and other excessive presentation of the male hormones,
Yes.
symptoms such as excessive hair growth, and all of that. But all of these can be managed
Mm-hmm.
to a point that the client will feel okay that presents its own. So it's not an end of life situation.
Mm-hmm.
Can be managed and patient is excited about what's offered. Thank
Okay.
you.
Okay. Thank you so much, Dr. Jean. So
You're
that's
welcome.
us wrapping up for today. Like I said, if you had sent this to someone that had questions about PCOS, if you had questions about PCOS yourself, I hope this has been more of an informative session for you and you're leaving with more knowledge than you came with. And also that some of those myths that you had or have been, debunked and you have more facts about PCOS. So thank you so much for joining us. We do love having you here, and that is why we want to have even more of you. So, like I said, September is PCOS Awareness Month. So, we're going to talk about PCOS again and again until the end of the month. So, make sure to follow us on our social media platforms. We're on Facebook, we're on YouTube, TikTok, and Instagram. And while you do that, turn on your post notifications so you don't forget when we are going to have another live session. We do this on Wednesdays and Fridays by 3 p.m. So in case you do forget, turn on your post notifications. It will remind you wherever you are. And if you're unable to join us, we still have these videos up on our platforms. That is on everyone I just mentioned: Facebook, YouTube, TikTok, and Instagram. You can go back and watch these other videos. And then you can do that as well for this video. You can go back and watch it. If you have any more questions for next time, you can leave a comment in our live session next time. Thank you so much for joining us. We do appreciate. Have a lovely day, and we will catch you in the next session. Bye.